For millions of Americans with debilitating health conditions, Social Security Disability Insurance, SSDI, benefits could be the difference between paying their rent or not having money for it. Most of them live check by check. However, accessing this SSDI benefit is often an uphill battle, a labyrinthine and grueling process where mistakes have crushing consequences. With 2026 approaching, new adjustments to the program's figures add another layer of complexity that applicants must understand to avoid being denied. The SSDI labyrinth, an attorney's advice for approval. The cornerstone of SSDI is a notoriously strict definition of disability. It's not simply a matter of a personal physician declaring someone incapacitated. The Social Security Administration, SSA, requires that a serious medical condition prevent any substantial gainful activity, SGA, and that this condition lasts, or is expected to last, at least 1 year or result in death. It's one of the highest standards in federal law, explains a disability attorney with more than 20 years of experience. It's not enough that you can't do your previous job. The SSA will analyze whether you could adapt to any other type of work in the national economy, considering your age, education, and work experience. What the SSA really looks for in disability cases. But before even reaching that medical scrutiny, applicants must overcome an administrative hurdle: work credits. This is where the 2040 rule comes in. Simply put, a person needs to have worked and paid Social Security taxes for at least 10 years, accumulating 40 credits in total. Half of those credits, 20, must have been earned in the decade prior to the onset of disability. By 2026, the value of one credit rises to $1,890. This means that, in practice, a worker must have earned at least $7,560 per year to qualify for the maximum 4 annual credits. For younger workers, there are special rules, but the principle is the same. Without a recent and substantial work history, the door closes before you even begin. 2026, SSDI changes. New COLA and crucial earnings limits explained. The new year brings annual adjustments that, while seemingly technical, can make the difference between approval and denial. The most significant is the 2.8% cost of living adjustment, COLA, increase, which will raise monthly payments. However, the figure that any applicant or beneficiary should pay the most attention to is the substantial gainful activity threshold.